Hello and welcome. It's Jody Kennett with Leap Fit Training Professionals. Really excited you're with me today because I am here for personal trainers who are working with people who have arthritis or who are preparing for or recovering post knee and hip replacement. So a little bit of background on me, you guys can find out more. I really want to get into the goods, but a quick snapshot is I've had 20 years experience working with hip and knee replacement clients, both prehab and post-rehab. And from that and teaching a joint replacement program, which grew into 6 classes of 12 participants each that we taught weekly and year round, I gained a lot of information. But I want to rewind way back before the 20 years, right at the beginning, where you may be right now. And I was afraid to work with people who had arthritis and also to work with people who had a new knee and hip replacement. They had a new implant. One of the reasons I was afraid was because these people are already in pain and they have a new implant or they have arthritis and swelling. You can tell they're in visible pain. How can we work with them and not cause more pain? Luckily, I didn't let fear stop me, and that's why I'm talking with you today, because as trainers, whether you're a kinesiologist, personal trainer, someone who works with these people who have arthritis or a knee and hip replacement, it is crucial for you to play a role in preparing them and recovering them. And here is why. First off, the reason we don't want to be afraid is exercise, and choosing the right exercise can decrease their pain. That decrease could be just for a period post-exercise, but it can also last longer than that. You can increase their quality of life. You can increase their function for their daily activities, both pre and post rehab. And in addition, you can look at what happens when someone's in pain prior to surgery. They stop moving because it hurts to move. Then what happens to our weight? Our weight goes up, and that load on the joints impacts even more so. So them learning from you and working with you and you guiding them on the right program can have huge effects on their quality of life, their mindset, and especially post-rehab. That is why we need to get them in prior to surgery. And a lot of clients and people do not think about this. And I want to focus on this key concept of working with people who have arthritis and who are waiting for or not quite ready for a knee and hip replacement, because we got the feedback, and it was so exciting, from the physios from the hospital, and they would say to our clients, "What are you doing? You're advancing way better. Like, look at these other people. They're not anywhere near where you are. We haven't seen this before. What is it you are doing?" And what they had been doing is they came in prior to their surgery and they maintained as much range of motion as they could. They gained strength, which absolutely helped them post-rehab. And they also kept their cardiovascular health because they kept moving, because they were guided with the right movement that wouldn't cause pain. Enter you, the personal trainer and kinesiologist. We play a crucial role. And not only is it we have a greater understanding of anatomy, of exercise, how the body moves. And because of that, we can give the right technique cues and we can give the right exercises. And I've learned the safe exercises that do not cause harm that really help our clients. And if you are at that place where you are afraid, or you're wondering what exercises are safe and you're wondering how to create programs for them, I do have a resource for that, which I'm going to get to later. But I first and foremost want to say, this is something you want to be promoting to your clients, whether they have arthritis, whether you don't have the clients yet. We all are ambassadors of how important it is to exercise before their surgery and while they have arthritis, and letting them know, we know you're in pain, we know it hurts to move, but hey, there are exercises that won't cause pain. There are things you can do to maintain, and there are things you can do to help you recover post-surgery even quicker and feel better in the moment, have better quality of life right now, even though you have pain. So if you are working in a gym, if you're in your own business and you're wondering if this is a client base you can work with or want to work with, what does it take to work with these clients? It just takes a bit more patience. It takes decreasing the fear of working with people who have pain And it takes knowing what exercises are safe and building the programs for them. That's all. So if this is a clientele that you really want to work with and help, I can tell you they are so rewarding to work with. And in addition, for you as a business owner or someone building your practice or your client base, these are clients that you can really build a long-lasting relationship with, because you can serve them prior to their surgery, serve them after their surgery, and actually, as you'll see and learn, there's quite a process post-surgery. It's not just a 3-month, bam, you're done, graduate, you can go live your life. They're gonna get benefits from continuing to work with you for a year, for 2 years post-surgery. And the programs need to be updated, 3, 6 months, whenever they're having progress. Very exciting group to work with, so fulfilling. I still work with them today. If you are wondering, how do I start? Where do I begin? How do I learn the safe exercises? I had a workshop that I created here because we had so many trainers that were helping in our group classes, and I realized I had gained all this information. So I packaged it in a 1-day live workshop that I taught locally. I'm in Vancouver, BC, but then realized there were so many questions from abroad and from other people that I needed to create an online course. So if you would like the full workshop that I teach in person here, I have created webinars. You can even get the full manual and exercise videos. I do have an online course at hipreplacementexercises.net. Even though it's hip replacement, I actually compiled all the knee and hip replacement exercises into one website. So you can find it all there, and the knee replacement has its own tab. But there is a tab for trainers, and you can go there and see the course and learn exactly what you need to do to program for this client base. Don't be afraid. Go help these people. They need our help, and they need your knowledge and your experience to guide them through the right technique and the right exercises, and really to stay with them throughout their journey. And you're going to really improve their quality of life. So I hope I answered some of your questions, decreased your fear, and lit a fire under you to go educate people of what they need and to start now. Don't wait till after surgery. Thank you guys for all being here. I love questions. Bring them on, and go visit the website, hipreplacementexercises.net. And we will see you on the other side of helping a lot of people. Thank you. Bye, everyone.